who's joining us. We're able to see all of your comments coming in. It looks like we've got people joining us from all over the place. I was seeing, let's see, we've got Sunshine State, we've got Montana, we have Tennessee, Wyoming, Minnesota. Juju says not even in the continent. That's fantastic. Michigan, Indiana, Seattle, Oregon, Tennessee, Florida, Maine. Holy cow. Illinois. Hey, from Spokane. That's where I'm at. Fun. Wyoming. I'm going to butcher how to say that city in Washington. I should know it better. I don't. I'm sorry. Alaska, Washington, Arkansas, New Mexico. Fantastic. Well, welcome so much. Feel free to continue sharing in that chat. And as we get going, I'm sure you all have questions or comments. I'll talk about that a little bit more in just a second as we get going. But we're so glad that you're here. I know people are still kind of filtering in as they're able to get logged on here. So we'll go ahead and do introductions to get started, and then we'll get diving into our conversation today. We're super glad to be here with you. I'm Deanna Tiemann, and I'm the marketing director here at Wilderness Medical Staffing. I will be your moderator today. At Wilderness Medical Staffing, we are a healthcare staffing agency. We specialize in placing physicians, physician assistants, and nurse practitioners in rural and extremely remote sometimes jobs in the Northwest United States and also in Alaska. We know that if you're joining us, if you heard about this webinar from maybe Wilderness Medical Society, which is a different organization than we are, super close names, but different, that you may be in a different specialty, different occupation than what we staff, and that's okay. We are glad you joined us anyway. We are going to keep that in mind as we talk to you today, just kind of trying to touch on a breadth of subjects and topics that will hopefully answer many of your questions about what it's kind of like to work in these rural and remote locations as locums. So I'm going to go ahead. I'm going to get started by introducing each of our guest contributors, and then I'll let them say a little bit about themselves, where they're joining us from, and just to make things a little bit fun. If they have any pets that might be joining us, we're all kind of chiming in here from our homes. Sometimes that means that pets like to join in too. So we figured we'd just give you a little bit of a precursor just in case. All right. Our first guest of honor is Kyle's Kitchen, PAC, who is a Wilderness Medical Staffing Locum Tenens healthcare provider and also a member of Wilderness Medical Society. As a healthcare provider, Kyle's has a really deep understanding of what it's like to do locum tenens work in rural and remote locations. Kyle's, can you tell us where you're joining us from and if you have any pets who might join with us today?
Hey, everybody. I am coming to you from Anchorage, Alaska, my house in Anchorage, Alaska. As Deanna said, I have been working locum tenens jobs for about the last 10 years, the majority in remote rural Alaska. I've worked with Wilderness Medical Staffing and a couple other companies and done individualized contracts and really have bounced around the state of Alaska with a lot of regularity. So I'm happy to be here and hope to be able to provide some valuable information for all of you.
Thanks so much. Any pets joining today?
No pets here.
All right, great to know. Next, I would like to introduce Sheila Gibson, who is an account executive for Wilderness Medical Staffing. She primarily works with clients in Alaska. She has years of firsthand knowledge living in rural Alaska and working in rural healthcare. Sheila, where are you joining us from today? And do you have a pet that might join?
I'm in Kirkland, Washington, my home in Kirkland, and I have a dog that he's right now squirreled away. He's hanging out with my husband in the back.
Excellent.
Yeah. And I'm excited to be here as well. It's an amazing adventure to work with clients and providers. Always excited to talk about this subject.
Awesome. Well, we're super glad you're here with us today. And last but not least, we have Lisa Vognild, who joins our panel as our Director of Recruiting at Wilderness Medical Staffing. Lisa has decades of experience working with physicians and APPs in both urban and rural settings. So she'll be able to speak about the differences and what attributes healthcare professionals need to have to be qualified for rural and remote positions. Lisa, where are you joining us from? And do you have any pets who might join in today?
Hello, everyone. Thanks, Deanna. I am joining from snowy South Dakota. This is where I live. I do have 2 blonde laboratories, but they are locked out because they would be demanding attention. So unfortunately, I can't let you see my 2 beautiful labs.
No problem. That's okay. Well, we're so glad to have you here today. I just saw a comment. It looks like somebody was asking about muting themselves. You shouldn't need to worry about it. Yep, Thomas, you answered that. We cannot see or hear you. We can just see a chat of the comments. So no worries if you're worried about being on video or if you're worried about, noises in the background. We can't see any of it as presenters, and neither should anyone else. So yeah, everyone's muted. Everyone's cameras off, at least on our end. That's what we see. So we are super fortunate to be presenting this webinar with the support of Wilderness Medical Society. Before we get going, I'd like to try to share a short message from them about their organization. This video is just over a little bit over a minute, about 1:30. Give me just a second, the technical details. I'm just going to try to share this with you just so you can learn a little bit more about them, but we will be right back to get back into the webinar.
We believe the wild keeps us alive. We stand for kindness, service, inclusivity, education, and nature. We elevate others as we climb. We see the need and fill the gap. We look to uproot barriers, not trees. We seek knowledge and pay it forward. We find our way in the wild. We are the Wilderness Medical Society, a community of medical professionals devoted to facilitating high-quality care in the outdoors. Our global membership and world-renowned experts affirm our collective authority to set clinical standards and disseminate the most comprehensive array of wilderness medicine knowledge. Our innovative programs, publications, research, and certifications equip you with the tools to practice in any environment, on or off the planet. Healthy lives are nurtured in wild places. Join us on the adventure and truly come alive.
Okay, I thank you for Wilderness Medical Society for providing that great video. Just so you'll know, for staying till the end of the webinar, I've got a 10% off coupon code to share with you if you are interested in joining Wilderness Medical Society. Some of the cool things that they've got going on. I know we've got some people joining from that organization in the chat, so we are happy to have them. Just a quick introduction. I'm joining you from Spokane, Washington. You may be graced today with my cat Nugget. She likes to kind of chime in. Hopefully you can't hear her purring loudly too much in the background. Today we've compiled a list of about 15 to 20 questions. These are all common ones that healthcare professionals who are considering rural locum tenens work want to learn about. They're things that they've asked us numerous times in different ways throughout the years. And so we just wanted to kind of gather them all together and touch on a lot of them today. So how this is going to work, we'll start kind of at the beginning with planning. And then from there, we're going to talk a little bit more about the facilities in rural areas, resources that you'll have working in a rural or remote area, or in some cases, resources that you may not have. And then we'll also touch on information about the communities. So we'll just keep it kind of naturally flowing in a conversational style as we get going here. But as you have any questions, if you have questions, feel free to put them in that chat, send them in to us. We've got several representatives from Wilderness Medical Staffing in the chat. Many of them have their names kind of labeled in there. We've got people from recruiting, people from our staffing department. We've got people from pretty much all of our departments in our team who should be able to help answer a lot of these questions, who work with providers in a myriad of different situations. And then I know we've also got some representatives from Wilderness Medical Society as well. So hopefully if we are not able to touch on your questions, that you're answering or asking in the chat, somebody should be able to touch on them. If we do get time at the end, we may be able to go back through and answer some of those if we've not been able to touch on them yet. So if you are also going to be joining us, just kind of as a side note, we have several people who've reached out and said they can't join the live recording that we're all at right now. They will be watching it as it's recorded later. And if you're going to be one of those people, so not talking to the live people, now talking to those who watch this later, you won't be able to see that chat. So don't be alarmed if you see us kind of referring to the chat. Don't worry if it's not there. It usually does not show on the recording. If you're live, you will be able to see that. All right, let's get this thing kicked off. First, let's talk about planning to work in healthcare in a rural or remote area as a locum tenens. Lisa, as a recruiter, what qualifications do healthcare professionals in rural medicine need to have?
Well, that's a great place to kick it off. So whether you're going to be working urban, rural, or remote, the qualifications for the basics are going to be the same. You've got to finish your program. You need to be board certified. For physicians, you could be board eligible because you have a period of time to practice before you need to be board certified, but that definitely is a requirement. As it relates to rural and remote, and just without saying that every single time, keep in mind that is what we're talking about, and that's really what we're referring to. So for rural and remote, there are additional training considerations that you can do. Those subspecialty programs, for example, for APPs, there are emergency medicine fellowships that you can consider and other certifications such as that. While they are important, when you're looking to be staffed, I will say that experience is even more important than some of those other training considerations. Of course, you need a license and a DEA, a license in the state that you want to be staffed in, and a DEA that you own that you can move around with your locum assignment. So that's the basics. Let's spend a little time talking about life-saving certifications. So again, the basics, while we have providers that come to us without any, we really consider BLS and ACLS the basics. And no matter where you're going, again, to be in a rural area where there's not a lot of hands and not a lot of people to respond, having ACLS and BLS is a minimum. If you want to be covering emergency medicine, you want to be taking call after hours where you'll be responding and be responsible for emergencies, we look at ACLS. Many of you have heard of CALS, which is the Comprehensive Advanced Life Support that's run out of Minnesota. If you're a provider for a long time, you probably know that course. If you don't, you can Google ACLS Minnesota. It's got the trauma in it like ATLS, but it has other things that are really specific to rural emergency medicine type of life-saving for that area. So look into CALS. That's a great program to have as well. And then while we don't see it required a lot with our clients, that the ALSO, or the Advanced Life Support for Obstetrics, and the PALS. Again, some clients will require that, especially if you're working in, say, a school type of clinic, they might want you to have the PALS certification. But above and beyond, not above and beyond all of it, but very important as it relates to being a locum provider in these kinds of settings, experience is something that you really need to have as a qualification, because you're going to an area that has limited providers. You need to hit the ground running, and you need to have the confidence and be able to practice independently without too much mentoring.
Mm-hmm. Perfect. Great. Yeah. Thank you so much, Lisa. The next question, we get this brought up a lot, especially for providers who have accepted an assignment. They're about ready to go on assignment. And so while it's not specific, feet on the ground in the assignment, you're not at work yet. Kyles, I'll have you start with this one. What do healthcare professionals need to know about packing for rural assignments? Feel free to talk about food, clothing. You've done this a lot of times. Anything else you want to touch on?
Absolutely. So yeah, there are some unique circumstances and occurrences that happen when you're working remote. And for everybody, remote means a little bit different. For some communities, remote is actually a 45-minute car ride away from, the nearest facilities. But in remote rural, especially in Alaska, it can mean that you don't have access to someplace else. So you definitely need to get a little information about your site. Typically, you can do an internet search to see some information about the size of the community, what the community offers. Your staffing company or your contract should be able to give you a contact person at the clinic or the site that can give you a little bit of background information to help you plan what it is you will need to pack or bring with you. Typically, you want to do a lot of the things like you would for Wilderness Medical Society, for an expedition. Make sure that you're packing stuff that you can haul yourself. Don't expect there to be porters or valets or Sherpas to kind of help haul your gear. Also, packing 2 smaller bags rather than 1 large bag, and using soft-sided luggage as opposed to hard-sided can really help when you're loading onto some of the alternative methods of transportation that we have to use for some of these sites. Finding out information about food availability. Some of these small communities don't have a grocery store, so you have to bring your food in with you, and being able to pack that and haul that as well is pretty important. Packing for weather, just like any outdoor activity, it's better to layer rather than have, big bulky individual cold weather gear or rain gear. And just making sure that you have a little bit of information about the site and the area that will allow you just to make decisions based on information.
Perfect. Sheila, you've worked within our company, both kind of on the operations side, helping providers to prep for that part of the trip, and then also kind of in staffing when they're about to kind of take those assignments. Do you have anything to add about packing for kind of these rural and remote areas?
Well, typically we have some facility information for each location where we staff, and so we typically have some basics. We might have information on, are there stores, what type of amenities would be in the area, so if you could pick up something if you forgot it, or you get there and learn that you need something. But at a minimum, if you have questions, ask. If we don't have an answer, we can certainly get that for you. Or as Kyle's mentioned, we can connect you with someone at the specific site so that you could ask directly. But we're always happy to do any of that.
Yeah, we also, for Wilderness Medical Staffing on our blog, on our website, we also have a handful of articles about food preparation for packing, about clothing to pack, especially for places with weather, like Alaska, where the weather is changing all the time, and it's a little bit more drastic than it might be in some of the other parts of the United States. So we've got some good articles about that. If it's something that you want to get some more in-depth information on, we've got some things that you can reference there as well. Sheila, I'll go back to you for this one. Can you tell us a little bit about what they can expect with housing in these types of places?
Sure. So we have really a variety of housing that we typically see provided. It varies a little bit depending not only on location, but also on length of stay. So if we have somebody, for instance, who might be doing, a few shifts at an urgent care, they might wind up being housed in a hotel. If we have somebody who's going to be doing, several weeks, most likely they're going to be placed in an apartment. Sometimes depending on the location or the client, sometimes we have providers who are in an Airbnb. So typically, though, if it's a longer assignment, I would say a week or more, most likely you're going to be in a location that has a kitchen, has a washer dryer. Some sites you might even have access to like a rec center or whatever. And again, we can determine that. We can, if we don't have that information already per facility, that we can just look that up for you. Though, as we work over and over with the same clients, we know generally what their housing options entail. So most of the time, I would say that the staffing process, the people who work in staffing can probably give that off the top of our heads. But if we're not sure, we can certainly get that for you. But it is going to be a range, and there are some locations where you might actually be in a clinic, be housed within the clinic if it's a very small location and they don't have separate housing available. So that would be kind of the three, probably either in an apartment or Airbnb or possibly a hotel or within the clinic.
Great. All right, Kyles, I'm going to toss this back to you. This might be a bit of a loaded question. Then Sheila or Lisa, feel free to jump in as well. But what can healthcare professionals expect when traveling to some of these assignments? What should they look out for or kind of know ahead of time?
Well, just go into it with a sense of adaptability, because something is likely to go wrong with your travel, whether it be weather delays or mechanical delays. Sometimes you'll get to your site and nobody's there to pick you up. So make sure you have contact information. Depending on the type of site that you're going to, the travel options can be broad range. I've traveled on everything from float planes to fishing boats to ferries, been picked up from the airports on ATVs and snow machines. Again, back to kind of the packing, make sure that it's stuff that you can haul yourself, and just kind of be adaptable. Make sure you've got contact information. Find out if your phone works at your site. Just be ready for a lot of things. Try not to stress out. Something will come and work out. And it really says a lot about folks, I think, how they adapt to some of those difficulties or changes or challenges that come about. I've seen different reactions from different providers, and the folks who seem the most comfortable and the most adaptable tend to do really well.
Yeah, we typically find that as well. Sheila or Lisa, do you have anything you'd like to add about traveling and what providers should kind of be ready to expect if they're on their way out to an assignment or back home from it, I guess?
One thing that we've seen a lot, just with some of the recent airline disruption, be prepared to be without your luggage for a day or two. Your luggage might go astray, or your flights may be just delayed and you may be stuck and not be able to get your luggage. We have some of this on our blog articles, but pack enough in your, anything that's essential, medication or certainly batteries, your laptop, anything that you would feel like you just can't afford to lose, take it in a carry-on. And one of the things that we do with each assignment, we send a final email that has contact information. So anyone who's going on an assignment with Wilderness, that provider should get near the end of the process or just before they would leave, a very detailed email that would have probably a couple of contact name and phone numbers or emails for people at the site, so that if you get there and you have an issue, you'll have somebody that you can reach out to. And of course, you can always reach out to us in staffing or the person you worked with in operations if you have some kind of a last minute question.
Mm-hmm. Perfect. Okay, Lisa, this one's going to be for you. How does credentialing work at rural facilities? Is it different? Is it shorter? Is it longer? Is it different than urban facilities? What can you tell us about that?
Okay. Before I do that, I just wanted to say chargers and nutritious snacks also.
Yes.
Throw that in the carry-on bag.
Thank you.
Chargers and nutritious snacks. Yeah, no matter what type of facility you're going to be staffed at, you're going to have some type of credentialing. If you're going to go to a critical access hospital, you're going to go into a hospital setting where you have a med staff committee that's, coordinators are going to prepare your files. It's going to go to a committee for approval. You're going to be meeting bylaws. You're going to probably get some status of staffing on their medical staff when we're talking about a hospital type of, and in those cases, you're getting a hospital affiliation, which I'm sure all of you are familiar with. And in that case too, you probably are signing off on a privileging document that says, these are all the things you are privileged to do in that setting. That is not always the case in some of the other places that we staff or that you might be staffed as a locum. For example, a clinic-only type of setting that doesn't have a hospital affiliation with it. That may be a shorter credentialing process because it may not need to meet Joint Commission standards or go through a credentialing committee like a typical hospital setting would be. So that might be a rural clinic that's separate from a hospital. That could be a small village in Alaska. That could be a correctional medicine facility where you're seeing inmates in a clinic setting or maybe an infirmary setting, but still, it's not an emergency room. It's not an inpatient setting. So that credentialing may be a little bit different, maybe shorter, less intense. Industries that you may be staffed at. So if you might be staffed in Alaska at an oil or gas company or a fishing industry, those two, because they're not affiliated with, say, a hospital system, credentialing may be shorter, requirements less intensive. So it really depends on the type of setting that you're going to be credentialed at or you're going to be staffing.
Perfect. All right, Kyles, you've been on a lot of assignments, worked at several different places. What can you tell the people who are joining us today about kind of overall, or kind of some variations, I guess, with who they will likely end up working with? Will there be other people on the staff? Will it be solo providers? Who will they work with? And then Lisa or Sheila, if you'd want to jump in on this one, you're more than welcome to.
Yeah, like Lisa was saying, the types of locations vary. So working at a critical access emergency room or small multi-provider clinics. Frequently, the emergency rooms and multi-provider clinics do have clinical staff that includes RNs and medical assistants, have some lab techs and some radiology techs. However, there are sites that you'll be traveling to, especially in Alaska, that have unique providers called community health aides or community health aid practitioners. These are usually members of the community who have gone to a medical training program that teaches them to treat patients kind of through a book of algorithms, the Community Health Aid Manual. And they do this in conjunction with a supervising physician who they can contact, usually telephonically if they have any questions or have recommendations, or if their manual recommends that they run this past their supervising physician. The thing to remember is that these community health aid practitioners are actually medical providers. So when you arrive at the clinic, don't expect them to be your medical assistant. They have their own patient loads. Many times, if there's not, if the clinic isn't busy, they're more than happy to, check your patients in and do their vital signs for you. However, that shouldn't be the expectation. Again, these are community medical providers, and they have their own patient load. So, especially in the small clinics, you as the provider are going to be expected to do front to back check the patients in, record, get your vital signs, draw your lab work, start your IVs, all of these things that may not necessarily be expected of a nurse practitioner or a physician assistant or a physician in a more in a larger practice setting. I saw some questions in the chat kind of about EMRs and some of the differences in some of the sites. Typically, you'll be informed about what EMR is used at the site that you're going to. If not, it's something you should ask about. It's helpful to have a little bit of experience, but typically during the onboarding or the orientation phase, they'll get you set up with the EMR and make sure that you have some experience or some practice with that. I've been through many of the EMRs. I've probably worked with 6 different electronic health records in the sites that I travel to. Some are better than others, and you know, some are a little bit difficult to catch on to, but you should have resources that help with that transition.
Perfect. Yeah, it looks like we had somebody in the comments, Pete. He's a one-man show over there in Aleutians. He's at a solar provider site right now, which sometimes happens. And I know, Lisa, in terms of recruiting, that is a lot of the reason that the people, at least at our agency, that we work with have to have the experience that we require. Do you want to talk a little bit about that in terms of what they might end up running into it with experience and just being maybe the only person there, or maybe one other person who's on the site with them?
Yeah, I think what we find sometimes is that a provider that may be doing emergency medicine in an urban setting may feel that work translates exactly into a remote type of setting, like you say, Pete's at, or a small village. When, you know, some of it does. All experience is good. All experience is great. But as Kyle's mentioned, and we can talk more about resources, it is different. So 2 years of experience is great. 24, you know, there's a difference. There's a difference. You know, I don't want to say the 2-year experience is not great. It's great, but it is different than 24 years of experience. And these settings are, you're on your own, and we can talk more about those resources down the line, Deanna.
Perfect. Okay, Sheila, since you kind of hands-on staff a lot of different types of facilities, can you talk to everyone about what the main types of facilities that healthcare providers or professionals might work at in rural areas?
So speaking about the areas that I staff, but I know, you know, there's certainly a lot of similarity among the 3 staffing regions. We have a few sites that are in communities that will have a hospital. Most of the sites that I staff, there's a clinic, and there's only the clinic in that community. So they are not doing any kind of inpatient. They are, if they have an emergency come in, they would be doing you know, an assessment, a triage, stabilizing if they need to be transported out, and then they would be sent out to the hospital or the facility where they would transport. Most of the time, I would say, you know, there's a good chance in a lot of our clinics that you would not be a solo. You wouldn't be on your own. I saw Pete's comment. He's a one-man show. I would say often there would be other staff there, whether they're medical or they're administrative, to support and help. There are times, just like in Pete's case, when you are on your own. And there's a range, you know, everything from people running the lab to running like X-ray, if there's X-ray. I know we have several sites in some of the locations that I staff that there might be just the administrative support. So again, when the provider is speaking with the staffer, the account executive, when you're talking with us about a potential assignment, we're going to tell you the environment that you're going to be looking at. So if you would not be best suited to be on a solo site, we're not going to ask you or offer that to you, because we don't want to put anyone in a position that is not going to be comfortable for them or safe for them or safe for the patients. And then we also, we have people who float, who can do either, who can do everything from being the one-man show to being in a larger clinic setting. And so there are people who can go between the two kind of extremes. We do have a few settings that are really just urgent care in nature, like our Department of Corrections. I saw some people asking about that. Those sites, they're infirmary sites. They're not going to be ER, needing ER type skills. So we do have some that are definitely more in the urgent care realm versus people who need to have emergency skills. I don't know if that covers it.
Yeah. Thanks. Yeah, as Sheila mentioned, and I think this probably differs, where you are in the country, at least in the areas that we staff, kind of in the Northwest and Alaska. It's clinics, critical access hospitals, Department of Corrections. We staff also, sorry, there's the cat again, different things like, with seafood companies, so some industrial type sites that are a little bit different. So yeah, different types of facilities. Lisa,
And like what Sheila was saying, there are different types of sites, and there are people who work between those. I'm one of those guys who works in some of the multi-provider sites and also in some of the solo sites like Pete. And I like that. I like that change. Usually the multi-provider sites have a little more emergency capabilities, so you're able to do more at those sites, and potentially prevent transporting everybody, and that kind of helps me at the solo sites where you may not have as many extra hands to be able to get that patient treated on site, and so that transport has to go through. But I think one makes you stronger for the other and helps you appreciate the differences between them. And there really is a huge variety of sites and opportunities. So I think everybody can kind of find an area that would fit them and suit them ideally.
Yeah, that's a great answer too. Thank you for adding that in. Lisa, can you touch a little bit on what some of the big differences are between resources that providers might have available in rural and remote locations, maybe that might be different than what they'd normally see in a more urban setting?
Yeah, I'll say a little bit more about that. Kyle's just trying to dip his toe into it, and he might have some more to add to this too after I add some points. Him being a provider, me not so much. Again, the staff availability. When I talk to, as a recruiter, I talk to providers who are coming from different settings that may be used to having a lot of other providers that they work with that are standing bedside next to them to bounce ideas off of. Having an extra set of hands. Keep in mind, in these areas, you may not have that. Again, we've talked about that. So that's where your strong clinical decision making is so necessary. To go into these areas, because there is not the numbers that you have available in the settings that you may be used to in an urban setting. And Kyle's already mentioned it, but again, support staff. You may be the lab tech and the rad tech and the nurse as it relates to collecting your own blood specimens, starting your own IVs, taking your own vitals, maybe even shooting your own films. We have heard of clients where they actually trained you to shoot a film. So, or doing your own handheld ultrasound. transport is different. You know, I talk to providers who are in an urgent care setting, and when they have something, a trauma come in, a stroke, a heart, they can call an ambulance and the patient is transported across town in an hour or two. Keep in mind, some of these areas, you are miles, hundreds of miles away from the higher level of care, whether that's in, say, a Montana critical access hospital or in Alaska where you're calling a medevac. That could take, you know, honestly, it could take a day or more for that medevac to get there and get that patient out if it's weather dependent. And that patient may be going to that next level of care by ground, by water, or by air. So those are the kind of differences. Equipment, again, Kyle's mentioned, if you're in a clinic setting, you don't have access to a CT if you've got a head injury or whatever the case may be. So keep those things in mind. Equipment, supplies, blood products. In Alaska, I don't know, Kyle can comment how often he's had access to blood products, depending on where he's at. And then meds. I think it would be important to ask Kyle to expand on what kind of medications in some of these very small villages or industrial areas, what kind of medications are actually available to treat.
Yeah, that's perfect. And Kyle's, I will take it over to you now. If you can touch on a little bit more kind of supplies, equipment, resources, what can people expect when they're on these assignments?
Yeah, for most of the assignments, especially the remote rural assignments, you may be in a community that doesn't have access to a pharmacy or a drugstore. A lot of the small solo clinics are, they have like a Pyxis or a pick point for their medication list with a very limited amount of medications in there. So your options are limited if it's emergency. Otherwise, for chronic medications, it's more of a mail out service that they have to set up with a pharmacy in one of the bigger towns. The equipment and supplies varies tremendously between sites. Most of the groups that have affiliated solo provider sites try and supply those regularly or have kind of a uniform variety of equipment available. You may not have the materials that you need for complete like medical interventions as you would in an urban environment. Like Lisa was saying, blood products, almost none of the clinics in Alaska have access to blood products. But the fixed wing flight services typically can bring in blood products for transport. There are several clinics that have gone to especially medications like tranexamic acid that has been used in a lot of military trauma to help stop bleeding. So some of those specialty products are available for use. So the more you know about that, and those products and that information is pretty valuable. A lot of that is covered in the CALS program, as Lisa was talking about. Typically, advanced trauma and life support is more hospital-based. Like Lisa said, you know, the advice is, you know, put them in a CT and give them blood. We don't have those options in a lot of the remote communities, and CALS kind of works you through that lesson plan, so it's definitely worthwhile. The types of equipment that you may have, it may be very rudimentary. Initially, it may be, you know, EMT level ambulance equipment. You may not have a ventilator. Typically, most places will have, you know, at least point of care lab and basic X-ray. A lot of places have handheld ultrasound, and you can do kind of point of care ultrasound, which can be really helpful in emergency situations, at least to rule out some of the potential, you know, high risk things. As we talked about, a lot of places don't have a real large variety of medications, but they do have medications to treat the types of situations that you'll run into. I have been in situations where we don't have medications for a rapid sequence intubation. So I've kind of stood at the head of the bed with my laryngoscope and my ET tube, kind of waiting for the patient to drop down or for the medevac flight to get there. So it can be challenging, but usually have the capabilities to do what you need to for the patients.
Perfect. Thank you so much. We touched on this just a little bit, but Lisa, I'll take it back to you if there's anything else you'd like to add. Just is there anything kind of crossover that we should touch on about how working in some of these larger facilities can translate over into rural settings?
Yeah, we did cover a lot of it, Deanna, and I know we're getting short on time with a couple more questions. So the one point that I want to bring to light that maybe hasn't come to mind as we've talked about it is the ability to care for a broad scope of conditions. You are the dermatologist. You are the nephrologist, cardiologist, endocrinologist, as it relates to any of those chronic conditions that you may see. You are the GI doctor. So as it relates to transferring your experience from a large facility to a rural setting where you may have all those specialties that you can refer to, at least initially, you're going to be all of those until you need to get a patient to the next level of care where specialty care is available.
Yeah, that was actually going to be kind of the next touch point. Kyles, can you talk for just a minute? We've got about 14 or so minutes left and a good handful of questions we still want to get through. Can you talk just a little bit about how healthcare professionals can end up getting patients transferred for next level of care if it's needed?
Yeah, so that's typically pretty site specific, depending on like where your location is. Frequently it includes, in some of the less remote sites, you may have access to wheeled ambulance to travel to your next level of care, depending on how long that is. I have been in sites that are on the road system in Alaska. However, it's a 3.5-hour ambulance ride, wheeled ambulance ride to the hospital, which means that if you have an ambulance crew of 3 people in your town, and you've just taken them out of work for the next 7 hours, that may not be your best option. There's also fixed wing medevac transport. As Lisa mentioned, there are several boats, fast boats that serve the island communities that can transfer to a hospital in another location. And we've actually used seiners and fishing boats to transport patients when we didn't have an actual medical fast boat or other ways to get folks over to either the next level of care or an alternative mode of transportation. Our fallback position is typically the Coast Guard. If all else fails, there's a lot of weather restrictions, a lot of daylight restrictions that some of the medevac crews can't fly through, and the Coast Guard is who we fall back on for those real emergent situations with real challenging circumstances. There are times when the Coast Guard will not put their crew at risk to come and get your patient, just based upon a 4-person crew as opposed to a single patient. So there are times when you have weather delays that can cause more extreme difficulties, but that kind of runs the range of transport to your next level of care.
Great. Okay. I would love if we have the time for all 3 of you to kind of touch on this a little bit. Just talking a little bit about what providers might end up experiencing within the community and cultures of rural areas, maybe the different types of communities, that they may kind of come upon if they're working out in these types of areas. Kyle's want to kick us off with this one?
Yeah, absolutely. Again, there are some site-specific differences. The Northwest, where Wilderness Medical Staffing works, there are a lot of Native communities that are predominantly Native or have a Native background. There can be some difficulties there as far as just kind of history in the Aleutian Islands. There, the Native population was kind of kicked out during World War II and then have come back in. There can be some underlying animosity, and the big thing is to be culturally aware and culturally sensitive. Other situations you may find yourself in, if you're working for industry, they have a lot of different ethnicities that work within the fishing industry, the fish processing industry. And so it's helpful to be open-minded and respectful, and just kind of anticipate that people are going to have different views, and try and kind of take that into consideration and provide, good quality care across cultural differences.
Great. Sheila, would you like to add anything to that?
A number of the locations where we staff in Alaska are Native Alaskan communities, but as Kyle said, we also staff in industrial sites. We mentioned some of the correctional facilities. In some locations, we have providers who are in schools. So I think really anyone who is looking at an assignment, again, when you're discussing the potential for location and dates, all the things, we will be able to tell you exactly what type of community or what type of setting. There will be no surprises. And if anyone is considering an assignment and they have concern about how they would fit in or whatever, I mean, certainly we are willing to talk that through or do whatever we need to do to either make someone comfortable, or if for whatever reason they're not. So one thing that came to mind, I know we've had some conversation about like people who are in maybe small communities in, the Alaska kind of wilderness, and, how safe is it, even in terms of like wild animals. And so I think, if you are considering a location that you're concerned about, your safety, are you going to encounter a polar bear or whatever? We'll talk through all of that and make sure that we don't ask anyone to go anywhere that they would have concern.
Mm-hmm. That's a good point. I know for a fact that we have put a few jobs on our website, and one of the points that we put on there is no bears on this island, which I think is kind of unique to our industry and what we do. I think let's kind of skip over. Lisa, did you have anything you want to add to that before I kind of move on to the next question? I don't want to skip over you.
Let me close out that question by saying, go in with a heart of service, work hard, and the community and the patients will know that you're there to serve.
Perfect. Okay, speaking of that, Kyles, I'll have you start this one. What do healthcare providers or professionals need to know about kind of being the new person in town, and how can they be successful coming in as an outsider?
Yeah, so a lot of it goes back to just what Lisa said. If you go in with a mentality of care and a commitment to serving the community, that's going to come across. That being said, typically you're in a small town, kind of in a fishbowl. You're the new guy, and you want to just kind of stay away from any social dilemmas. Don't want to, get a reputation for, being lazy or you're not being available. Just try and avoid any of those, new person problems. Typically, you'll meet people initially through the clinic. Remember, small towns talk. There's a lot of gossip, so it's really hard to maintain HIPAA when you're in a small town. I frequently do not say hello to people in the grocery store or on the street until they address me first. I don't want anybody to, it's not a good public bit to, go pat somebody on the back. That kind of lets everybody know they've just been in to see you at the clinic. So HIPAA can be a little bit tough, but again, if you come in with a attitude of caring and concern and doing your best, that usually goes a long way to establishing a good reputation within the town.
Perfect. And Sheila, you've worked at healthcare facilities in Alaska. You've worked with locum tenens for a long time. Do you have anything to add to that?
I do. So Lisa, I think, touched on it, just saying, come in with a spirit of wanting to serve. That is very important. But also, I would say, remember that you're a guest and you are not there to take sides in staffing issues or even in community, don't get involved in the community politics or whatever. I mean, it's fine for you to have your opinions, but it can be a bit of a trip hazard, if the clinic staff begin to see you in a light that you really shouldn't be seen in. So you're there to be neutral and kind, and remember that you're a guest.
Great, thank you. Okay, and then Kyle's, besides maybe a couple questions, if we have just a minute, kind of from the chat that came in. When you're on these assignments, when you're not working, what do you do?
Well, there's options. Again, if you're at a multi-provider site, that typically means that you're not on call all the time. So you have a little bit more freedom. I love the outdoors. And so being able to get out and get about and enjoy those locations is one of the big attractions. That being said, when you are at one of the solo sites, you are typically on call 24/7. And so the expectation is typically that you can respond to the clinic within 20 minutes of an emergency call. So your gallivanting is a little bit limited. Again, you can usually find some way to be outside and enjoy your area. A lot of the sites have very little kind of, non outside recreational opportunities. And some of the housing doesn't necessarily have television. Some of them don't have computer or internet access. So try and, I typically pack books. A Kindle is great. Bring your own music. Don't expect there to be data streaming or anything beyond kind of glacial internet. I have been to sites where they put in internet in the housing, and the first person there ran up a $450 data bill by streaming movies the entire time, and so they canceled that. So it's best to take movies on your computer or on a hard drive. I have a little iPod, one of the old wheel iPods that I take with me for music, just in case I can't get it online. Usually the clinics have good computer access. They need it for transmitting images and also for doing VTC. So you should have a way to kind of download something during the day from the clinic that you can watch later on.
Perfect. All right. Well, we're getting really close to kind of wrap up time. So for our guest panelists, do you have any additional closing thoughts that you'd like to share?
For me, I mean, I really enjoy locum work, mostly because I like to do a lot of other stuff. And I think locum tenens gives you a great opportunity for work non-work activity balance. For a lot of the members of the Wilderness Medical Society, you guys trying to get your diploma in mountain medicine or your diploma in dive medicine or your FOM, trying to get all those long conferences in, especially in the time frame. I think locum work is the best option to be able to allow you to do that. And the variety. I think it's really easy to get locked in. I know during COVID, there was a lot of stress, a lot of increased workload for a lot of providers. And I think being able to skip to someplace else, do a short-term contract, and then go on to something else, or return to the sites that you really enjoy is a great option.
Yeah, I agree. We get that a lot from providers, and it's actually very helpful for both the providers and the communities when you go back over and over again. Sheila, anything you'd like to add real fast?
Yeah, come check us out. Come see us. We're always looking for people who are ready for an adventure and want to take their medical skills along with them.
Perfect. Lisa, you're up next.
Visit our website, and if you have any questions, just reach out. We'll get the answer for you.
Perfect. Also, if you're joining or interested in joining Wilderness Medical Society, as I said at the beginning of the webinar, you can visit wms.org. If you click on the red join button in the upper part of your screen, you can use promo code LOCUM10, so LOCUM10, to get 10% off of your membership. So super special thanks for offering that. Also, within the next few days, you'll get a quick survey from us at Wilderness Medical Staffing. For taking it, you'll be entered to win a $50 REI gift card for one winner who fills out the survey entirely. So for all of the people who fill those out, we'll pick a winner out of you, and we will award that person a gift card to REI. We really appreciate the feedback, so we can continue to host webinars for you in the future, and really, really appreciate you taking your time to join us today. If we did not get to your question today, don't worry about it. Apologize. We can actually see all of the questions that you asked. So I'll go ahead and go through all of them. If we weren't able to touch on them, someone from our team should be able to reach out, or from Wilderness Medical Society if it more so pertains to them. So we'll kind of get the questions and address them back to you. So just keep a lookout on your email over the next week or two as we kind of go through those, and we're able to answer all of those for you. Again, thank you so much to everyone who took their time out of their day to join us today. We really, really appreciate it. If you've got any questions for us, feel free to submit them through our website. We've got a chat. We're on social media. You're always welcome to get a hold of us in whatever way works best for you. So thank you so much. We really appreciate it. Bye, everyone.
All right, y'all take care.
Bye.